Good, happy Friday morning, May 14, 2021. I'm Riley King, and welcome to this Friday morning edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Friday morning, so let's begin. First up, situation at True Hotel in Manchester resolved safely, officials say. Police arrived to hear what sounded like gunshots, officials say. Let's take a listen to that video from WMUR News 9.
Tractor has been in our family since 1955, when great-grandfather Pearlie and our grandfather George decided to sell tractors out of
Manchester. A standoff between police and a man inside a hotel has just come to an end. Good evening, I'm Monica Hernandez.
And I'm Mike Cherry. WMUR's Jason King joins us live near Spring and Canal Streets with what we know right now.
Yeah, Mike, we're live here on Commercial Street in Manchester, where earlier this evening, police were called to the True Hotel to check on someone's condition. Now, according to the Manchester Police Department, arriving officers heard what sounded like a gunshot and immediately secured the area and evacuated surrounding hotel rooms. Crisis negotiators tried to get the man in question to leave his room, but he refused. This went on for several hours. SWAT officers also on the scene, but according to Manchester PD, they were not aware of any victims, so it seemed like an isolated incident. And now at this hour, as you mentioned, the incident has resolved. I was just told that it ended peacefully and the individual is getting the help that he needs. So a happy ending to tonight's story here in Manchester. Live in Manchester, Jason King, WMUR News.
Okay, and there you go on that video and that report. New Hampshire health officials caught off guard by new CDC mask guidance. Let's take a listen to that video from WMUR News 9.
I think what sets us apart is the fact that our technicians live and breathe only chimneys. It's not a part of our company, it is our company.
Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing.
Masks are still required when traveling on planes, trains, and buses, and people with compromised or weakened immune systems should consult their doctors. The CDC says the change is due to dropping case counts and a rise in vaccinations.
There's still COVID-19 and risk in our communities. This is where we want to head. The question is, is now the right time?
State epidemiologist Dr. Benjamin Chan has concerns, saying about half of eligible people are vaccinated in New Hampshire, leaving a large segment of the population vulnerable.
That's a lot of people that are still susceptible in the communities. And the second piece of this is also the level of community transmission. Most states around the country, by CDC's criteria, still had a, quote, substantial level of community transmission.
He's concerned about prolonging the transition phase of the pandemic and questions why state health officials were not informed or provided data in advance.
We never just simply adopt it because CDC has put it out. We've always, throughout this pandemic, taken the time to review it, understand it, to look at our own numbers, look at our own situation, and make decisions based on our own local context. And we'll do that in this situation as well.
Important to note, the CDC masking rules do not apply to the workplace or to businesses, so you still need to follow the rules there. In Manchester, Jean Mackin, WMUR News 9.
Okay, and there you go on that video and that report. Governor Sununu expands access to mental health services after state Supreme Court ruling. Let's take a listen to that video from WMUR News 9.
This is your moment to get a healthcare plan at a price that fits your budget and the care you deserve.
Today I am signing an executive order. It will allow the state to take immediate, targeted, and direct action to ensure those in mental health crises have timely and appropriate medical care.
Governor Chris Sununu today directing the Department of Health and Human Services to increase access to mental health services, promising to open more beds at New Hampshire Hospital in the coming days.
It is an opportunity to finally break down barriers that we've been trying to break down for years.
It comes after a state Supreme Court ruling in a landmark case in which a woman was held in the Dartmouth-Hitchcock ER for 17 days after she was involuntarily admitted for mental health concerns before getting transferred to New Hampshire Hospital.
Boarding was wrong medically, legally, ethically, economically, and morally.
The National Alliance on Mental Illness, or NAMI New Hampshire, says as of Wednesday, 36 adults and more than 20 children were also waiting in the ER on beds to open up for emergency mental health services.
There have been several attempts during the last couple of years to expand bed capacity and some other community-based services capacity in the state that have not been successful.
The governor says the state had made strides over the years with no wait for inpatient psychiatric beds before the pandemic, but then came a workforce shortage and an increase in stress and mental health issues due to COVID-19.
It really was a perfect storm that really kind of pulled us back a little bit to where we were.
The governor's executive order also calls for DHHS to create emergency rules to increase access to mental health services and review all providers across the state to make sure they are capable of meeting the community's.
Okay, there you go on that video and that report. School districts, hospitals set up clinics for vaccinating children age 12 to 15. Let's take a listen to that video from WMUR News 9.
The past year has tested the toughness of every last one of us. Mahindra tractors have been there for our tough customers as they continue.
It's been a whirlwind as far as organizing and whatnot, but we'll have all of our first dose clinics done by Tuesday.
The Plymouth School District began vaccinating students Thursday morning, just hours after the Pfizer vaccine was approved for 12 to 15-year-olds.
At this point, I think it's important to at least offer it to families and to have them have the convenience of just coming into the school.
The clinics will be done during school hours. Children will need parent consent.
If, families want their children to get vaccinated, it can happen fairly quickly.
State vaccination sites are also accepting appointments, as well as some hospitals. Littleton Regional Healthcare is ready to vaccinate kids 12 to 15, Monday through Friday.
Parents can go online and register at Vinny. And as long as they give consent on Vinny, then the child can, come through the drive-thru with another family member.
Staff will also be helping school districts in their area host clinics of their own.
We weren't really sure what to expect with acceptance for this age group, so I'm really very excited to see that we're off to such a positive start.
State health officials say the vaccine is effective and safe for kids.
While they're less likely to develop severe infection and die, that risk is potentially there. And so why not make that choice to protect your child from COVID-19?
Littleton Regional Hospital says if there are school districts in the North Country that need help setting up a clinic of their own, they would be happy to work with them. Reporting in Manchester, Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. Four more Granite Staters die of COVID-19 as hospitalizations decline. Let's take a listen to this video.
the easy and the complex, the small stuff and the big. We're here with the affordable local loans, easy to manage accounts, and financial advice to help you blaze a trail, figure stuff out, and make your money go farther. We're Granite State Credit Union. Live bold.
So in terms of the numbers, we are announcing 222 new people diagnosed with COVID-19 today throughout the state. Our numbers continue to go down, which is good news. In the last week, we have averaged between 150 to 200 new infections per day, and we continue to see the average number of daily cases decrease. Currently, statewide, there are 1,450 people with active infection. Our test positivity rate also continues to decline. We're currently averaging a test positivity rate of about 3.0% over the last week. Hospitalizations are also declining. 62 people are currently hospitalized statewide with COVID-19. Unfortunately, 4 new individuals that we're announcing and reporting that have recently died from COVID-19, bringing the total number of deaths during this pandemic to 1,326. Now, none of these new deaths are in people associated with long-term care facilities, but this highlights the ongoing risk that community transmission poses to our most vulnerable populations in New Hampshire, and why we continue to stress the importance of vaccination for everybody who's eligible to receive the vaccine. COVID-19 vaccines remain widely available throughout the state with open appointments. We continue to strongly recommend and encourage people who have not yet been vaccinated to sign up for the earliest available appointment to receive their COVID-19 vaccine, and continue to stress the importance that anybody who has received the first dose of either the Pfizer or the Moderna vaccines, which is a 2-dose series, to absolutely get the second shot. Studies have shown that full and complete vaccination provides the highest level of protection and the longest duration of protection, even higher antibody levels than natural infection alone can provide. And so even people who have been previously infected with COVID-19 should still get the COVID-19 or one of the COVID-19 vaccines. Getting vaccinated is low risk and of very high benefit for protecting oneself, one's family, one's community, and ending this pandemic requires us all to be vaccinated, or to have as many people as possible vaccinated to protect against COVID-19. With that, I will hand things over to Dr. Daly. Thanks.
Great. Good afternoon, everyone. I have a vaccine update for you. To date in New Hampshire, we have administered 1,267,000 doses of vaccine. This includes 750,000 people who have received their first dose, and that is 55% of the total New Hampshire population. Of those, 555,000 people have been fully vaccinated, which is 41% of the total population. We continue to receive around 50,000 first doses of vaccine each week between the doses that are allocated to the state and those that come in through the federal programs. This week, as you've probably heard, the Pfizer vaccine was approved and recommended for use in children 12 to 15 years old. Parents can now register their children 12 and older for vaccination in Vinnie at vaccines.nh.gov. We have already had 6,000 12 to 15-year-olds register out of the 60,000 people in this age group. Because 12 to 17-year-olds can only receive the Pfizer vaccine, we do have a list of locations that provide Pfizer on the website and as part of Vinnie. So please be sure to register for a site that has Pfizer. The sites are listed here, and this includes all of our state fixed sites, Walgreens, and then several different hospital locations as well. Additionally, our regional public health networks are working with school districts to set up vaccination clinics for children 12 and older. Now, some people have asked why it's important for kids to be vaccinated, and it's true that children are more likely to have mild symptoms or no symptoms at all. However, some children can get severely ill and require hospitalization. Over 3 million children in the United States and 15,000 here in New Hampshire have had COVID-19. And among these infections, there have been around 500 children who have died from COVID-19, including from multi-system inflammatory syndrome in children, or MISC, which you'll recall having heard about before. So even though children are at low risk for severe infection, getting vaccinated will help keep them healthy and in school, and it will help to protect the people around them who may be more vulnerable to severe COVID-19 infection, including their parents, grandparents, as well as any children who are around them who have medical conditions that put them at risk for severe COVID-19 infection. We have seen even young, otherwise healthy people get hospitalized or have weeks or months of breathing problems that impacted their ability to play sports or exercise. So we do encourage all parents to make that choice to get their child vaccinated. At this point, about 66% of the people in New Hampshire who are age eligible have already made the choice to get vaccinated, and we think this is a great start, but we need more people to make this choice. We have thousands of open appointments available at hundreds of locations across our state where you can get vaccinated. We also continue to go out into the community and have mobile clinics to make vaccine as accessible as possible. Along these lines, we have been working together with Elliott Health System to host a vaccination clinic for people who are deaf or hard of hearing and their family members and their caretakers. This clinic will be held on Saturday, May 22nd in Manchester, and they will have on-site ASL interpreters. Appointments are required, so to sign up, we want you to contact us by May 19th. You can contact us by video phone, and the numbers are here on the slide, 603-546-7882, by voice at 603-271-9097, or email at equityvaccine@dhhs.nh.gov. And then finally, we also have partnered with the state of Vermont to conduct a New Hampshire-Vermont clinic. This will be a drive-through clinic. It will offer the one-dose Johnson & Johnson vaccine on Friday, May 21st. And you can sign up for that clinic at vaccines.nh.gov and search for Lancaster. So please do go ahead and make that choice to get vaccinated to help protect you and the people around you and help us all get back to normal. Turn it over to Commissioner Shibinette.
Good afternoon. Just a brief outbreak update. We have no new outbreaks to announce. We do not have any outbreaks to close. So we remain at 2 institutional outbreaks in New Hampshire, one at the Federal Correctional Institution in Berlin and one at Sullivan County Healthcare. Under our homebound program, we have vaccinated 4,048 homebound individuals for COVID-19. We have 301 individuals remaining to be vaccinated and are still scheduled to complete our homebound vaccination project by the end of May. Thank you.
Okay, and there you go on that video and that report. Search for DC baby Kyan Jones continues. Police chief hoping child could still be alive. Let's take a listen to that video from ABC 7 News in DC.
Changing subject, anything on the 2-month-old? Any progress there? Anything you can tell us?
Yeah, we're working on that case, and hopefully we'll be coming to some resolution on that very soon. I know there's a lot of media reporting out on that. We're doing everything that we possibly can to locate this child at this point. I know there's some reports out there. Yes, the mother is a person of interest in this, and in fact is the only person of interest at this time. So we're just working through that very carefully with our partners at the U.S. Attorney's Office to make sure that we do the things that we need to do as we move to the next step in this.
Is the search continuing down at this landfill?
The search has continued, and we should be wrapping that up today.
Do you have a video of this woman throwing things into the garbage? I understand you have a video.
Yeah, that's part of the investigation, Paul.
So you do have a video showing her throwing things?
That's part of the investigation. Yeah.
Okay, I didn't know that. So you do have a video of a woman possibly
No, not specifically of that. He said things, yes. So again, that's all part of the investigation. We'll continue to work through that. We'll continue to work with the family. I mean, this is just a tragic, very unfortunate case for this child to be unaccounted for these many days. I am hopeful and was hopeful and remain hopeful that perhaps, just perhaps, that this child is somewhere out there. And I want to make sure that we do everything that we can as the Metropolitan Police Department to locate that child, if that child is alive. And unfortunately, if the child is not, that we hold people accountable in the event that we need to do that.
But you have hope that the child is not down. You have not found the child down there.
I have not found the child yet. That's correct. Yes. Yes. Could be. Thank you guys for your questions. I really appreciate it. Yep.
Okay, and there you go on that video and that report. And thank you for joining us for this Friday edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your day. And I'll see you back here later on today for another newscast. I'll have a news report coming up in a little bit. Goodbye, everyone.